4-minute nervous system regulation. This comes from being able to breathe properly, use our diaphragm, and have movement and elasticity through our fascia, as well as using tools to activate the vagus nerve. So we're going to start with making sure that we have good posture. So thinking about getting really nice and tall, like a string pulling through the top of your head, bracing through the feet, feeling the feet on the floor, and taking deep breaths into the ribs. See my ribs expand. And then exhale, let the ribs gently knit together. We're getting tall, tall, tall through that whole breath. So I'll show from a different view. We're expanding the rib cage, letting the ribs relax, trying not to use our shoulders or our neck muscles to initiate the breath. We're trying to originate this from our diaphragm or our rib cage. And our diaphragm is essential in regulating the vagus nerve, as well as getting the mobility in order to breathe and in order to fill our lungs. That feels really good and safe in regulating to our nervous system. If you're noticing it feel a little tight, you can take a few moments to gently release the diaphragm or the upper abdominals. You can do some fascia release like I'm doing here to help open up that diaphragm. And then get back into those nice diaphragm breathing. We want to see a lot of rib cage movement when we are getting our diaphragm going. So just check in with yourself, make sure it feels even, make sure you can expand the rib cage on both sides. Now we're going to prepare to do an additional stretch. So we are taking that deep breath, exhaling, still really long through the spine. And on the exhale, stretching the ribs back out while we're getting long, long, long through the spine to create that vacuum or that hollowing in the abdomen. So you can see from the side, you inhale, stretch the ribs apart, exhale, knit the ribs together, then hold your breath and stretch the ribs, get tall, tall, tall. This is decompressing the spine. This is helping the fascia of your internal organs. This is regulating and stretching the vagus nerve and diaphragm. And then you inhale to release the pressure. So while you're doing this breathing pattern, you can put your hands behind your head. Use your peripheral vision. So train your eyeballs to the right. And just leave your eyeballs in that right-sided position until you notice a yawn or a sigh or some level of relaxation. It's helpful if you're still breathing through your diaphragm and your rib cage. Switch eyes to the other side, peripheral vision. Just waiting for that sigh as you continue to breathe in and out. And let that relaxation enter your body. You can always jump for joy, wiggle around a little bit to release some of the tension in the fascia, and there you go.